One is Roma women on stage, and the other is from a frozen forest to the heat of the scene, of the theater scene. So I will tell very freely about this project, and yes, you are not just start to work with a group of Roma people dropping down from Budapest, or in my case from Stockholm, to a village and work with Roma people as much as Agnes not either were dropped down from the heaven, but it's a long way it's a long preparation actually for this kind of work. One of my students, she is a cultural anthropologist, social and cultural anthropologist. So she was writing her dissertation, and in this work, it was field work. There was she had to do field work. So she was living with a gypsy family, with a Roma family, in 6 months. And in that way, we have the contact, because she was the link for the first trustful meeting, so to speak. And there is also a Roma association in the village, Somoya, with the leader who is a social worker. So that was also essential and important, because first we had women from 2 villages, 16 women, but from the other village, there was no, in the other village there was no social organization for gypsies, so the leader of that couldn't negotiate with the mayor, which was needed to let them go to this group instead of working. They were communal laborer, with a very low salary, under the minimum, existence minimum, and they are obliged to work. Otherwise, there is no health insurance or social insurance whatsoever. So it's very undemocratic, and it's a horrible system. And the work they do, that's why I call it from the frozen forest, because actually they were working in winter in minus 10, 15, 20 in the forest, with bad equipment, with bad clothes, and the shoes, they had shoes in order to at least have something. What do you call it when you have an iron finish of the shoes? Yeah, anyway. But this iron piece in the shoes get frozen. So this damages their feet. And you can't imagine. And nowhere to sit, nowhere to eat, they make up the fire in the forest. These are civilized gypsies. These are modern gypsies. They are not nomads, so to speak, but have this work. And also painting benches in the village, cleaning the village, whatever work you see around, people doing this work, and that is a communal work they do. So it was very, the first meeting we met, we were choosing women who didn't have any more small children, because if you have, you cannot come. And we wanted to have a continuation and continuous work. So they came for the first time, and they stayed, all of them, every time. And they were just longing for these sessions because they just realized how important it is to share. They knew each other. Sometimes they were working together in the same group, working group, but on another level, on a more surface level. But in this group, they know each other more intimate, and also the confidentiality was important. So the safety and the trust in us, in me, the trust in each other, it was growing. It was 9 months of work, yes, about all kind of issues. I made both psychodrama, sociodrama, psychosociodrama, because some personal issues were quite general, so we made a sociodrama about it. Or some very general issues were very personal also. So we went back and forth on these different levels. And we were filming everything. And the second part of the project was to create together a theater play. So we had a dramaturg who wrote a play out of the films. And we choose the focus on healthcare, because there were many, many different issues. But we wanted to focus on healthcare of the women. And the theater director was with me all the time, who made the play, who directed the theater play later on. Do I have? Yes, okay. So it was so interesting because at the beginning, we didn't want to talk so much about it, because not to threaten them that they are going to play. There was no way they could imagine that they can stand on a stage, you see. But we went to another theater in a bigger city together with them, and there were Roma people who were playing, but not their own stories. It was an ordinary theater play. So then they said, "Oh, is the way we are going to play too?" So they got it from somehow, and the empowerment, to encourage the spontaneity, or cool down the spontaneity. Sometimes it was also an issue, because how they communicate very quickly, very cleverly, very quickly. And it was sometimes very chaotic. So I really had to make peace in order to listen to each other. That was a process to get people say things one by one, the talking stick. And now they are perfect, better than anyone else, in group, because I will tell you the continuation of this project. So the theater play, it was in the village first. The women are telling their own stories. And it is, I would like to read this, what kind of issues we had. It was also the loss of newborn babies by medical mistakes, birth damages, wrongly diagnosed diseases, too expensive medicines, carrying a non-treated disease from childhood, alcohol abuse, general practitioners who prescribe sedative and make people dependent on these substances, the ambulance arriving too late or not arriving at all, neglecting by the doctor cynical comments, the obligatory gifts to the doctors, the sterilization without consent. Horrible stories. Yes. And they ask the questions. Are we suffering all this multi-treatment because we are Roma people, or because we are uneducated, or because we are poor? We cannot give presents to the doctors. So, how many minutes do I have?
4, 5 minutes.
Oh, my God. Anyway, so there was in a village and another city, and in Budapest, the performance, the play. So it was such a big success. We just wanted to play once, 3 times, once in Budapest. But we were playing 4 times in Budapest because it was such a success, and it was a tremendous writing about the play in journals, in theater journals, in newspapers. So it became really popular, very famous, this play. And we were invited to Dresden to a theater festival. And the first time they were flying, and they had to change in Zurich or somewhere, and they said, oh, then the second time is always easier. So they really managed even the most frightened ones. Wonderful, intelligent, clever women who are really survivors. I mean, not gypsies couldn't survive that way of living they live. So, the second part of the project was go to the countryside, to other poor villages, and play the play and lead the discussions. The women were leading the discussions after the play. And also in Budapest, I had a social drama with the public after the theater the next day. And also in Dresden, it was subtitled with English and German. So, but we go on, not the play, even if it's very attractive to be a star, so to speak. But the purpose is not that. The purpose is to build communities, to be a better understanding of the healthcare for Roma women. So now a new project is going on. We just started with doctors, medical doctors, with the women, with activists, and with nurses. So that will be very interesting to see how they can cooperate and go out to hospitals and healthcare places to make the change, to make changes in the healthcare for women. So the play was called Long Live Regina, and we call this new project Regina's Daughters. So they don't have to experience the same humiliating issues. Can we just show the slide very quickly?
The pics.
Yes, the pics. Because it's nice to see. This was the beginning, where they come from the forest, from the forest. It was the very first. And the cleaning lady didn't want to clean the place because they were gypsies, you see. So I started to clean the place. So, but later on, the restaurant we were eating at, it's not usual that the gypsies are eating in a Hungarian restaurant. They became our fan club later on. So this is the very first, you see? Yeah, go on. Yeah. Was Yulishka was raised up in a child home. Yeah, please. Yeah. Yes, she also. Yeah. She's a real actor, you know. We had a real actor in the play because it was very good to inspire them. Yeah. They loved her and she loved them and she's wonderful. So he was a gaggio. He was playing a gaggio, you know, a non-gypsy. Yes. Yeah. She's my student. I'm the brain behind the project. Very talented. Okay, go on. Yes. Sitting here. Yeah. Yes. It is together with the other group I talk about that who couldn't come with us. This is the theater director, Edda. These are some scenes. Yes. A lot of cry, a lot of laugh. They are paying the trial against the mayor. Okay. Okay. At the first rehearsal. They are telling these horrible stories about sterilization. It's a dream work. Just some more. Oh. This is the dramaturg. This is the director. The first rehearsals. The first announcement. The public, also with children. They have the children with them. Is the, yeah. Okay, this is the public. And yeah. So thank you very much for your attention.
Thank you, Judith.